Hello from Brisbane in Australia, and thank you for the opportunity to present at this conference. In this short presentation, I'm going to introduce a study project that we have been conducting at the University of Queensland Centre for Clinical Research, focusing on the development and pilot testing of a psychotherapy program delivered completely via telehealth to alleviate anxiety in persons living with cognitive impairment. Dementia is a highly prevalent condition worldwide, and the World Health Organization considers dementia to be one of the major causes of increased dependency in older people due to its broad impact on the person's life. One of the conditions often experienced by people living with dementia is anxiety, often leading to further incidence and exacerbation of other psychological, cognitive, and emotional symptoms, and variety of changed behaviors often observed in people living with dementia, contributing to a decreased quality of life. However, there is emerging evidence for psychological interventions, particularly cognitive behavioral therapy-based interventions, to be effective in people living with cognitive impairment. And so we have designed a 6-week psychotherapy program consisting of psychoeducation, anxiety monitoring, sleep hygiene, and relaxation exercises to be completely delivered via telehealth. We have made a number of adjustments to tailor the in-person therapy manual to be delivered via video conferencing and to best support people living with mild cognitive impairment and dementia. For example, we provide video guides to facilitate the between-session practice of the taught techniques, and we also invite support persons to be engaged throughout the therapy program. We have been testing this therapy program in 3 stages. Firstly, we have tested the proof of concept of this program, and this is the study procedure for the proof of concept study. It's been delivered in case series using a mixed method design. We were gathering qualitative data such as therapist notes and participant feedback via qualitative interviews post-intervention. We were also gathering an amount of quantitative data. And together we were using all this data to evaluate the preliminary outcomes, but also for further process evaluation to inform a larger randomized control trial. So this is just an example of the results of one of our participants in the first stage delivered in case series. So it is a person living with frontotemporal dementia who, amongst other anxiety symptoms, reported COVID-related worries. And this was due to prolonged restrictions and isolation, and consequently, this person worried that this isolation might actually lead to further loss of skills, such as social skills or how to use public transport. So this person completed all 6 weekly sessions, and we were looking, like I said, in case series, we were looking at the individual results from pre to post intervention. We were using reliable change index to capture clinically significant change on individual scores. Our primary outcome measure is rating anxiety and dementia, and we were using this reliable change index analysis. Using this analysis, we could observe a clinically significant decrease in anxiety. And we also look at various secondary outcomes, such as depression, which in this case also showed a clinically significant decrease from pre to post intervention. Now, moving forward from this proof of concept study, we are currently conducting a pilot randomized controlled trial to further test the efficacy of this intervention and to inform future stages, which involve a development of assistive technology to further facilitate the between-session delivery of this program, and also we will look at the economic and process evaluations of this therapy program. I would also like to acknowledge and thank the whole team of investigators, partners, and consumer and community representatives who have been involved in the co-design of this study and also in running and then the execution of this study. Thank you, and feel free to reach out using the email on this slide. Thank you.